Hi, I'm Carolyn Grafton. I'm a health coach, and I'm really passionate about nutrition. A person who has their health has 1,000 dreams. A person who does not have their health has but one, to get their health back. I found this out 32 years ago when I got sick and almost died. I was a mother of 2 growing boys and a woman engineer in a company of all men, trying to prove that a woman could do as good a job as a man, and that and I gave my all to my company, to my family, and I forgot to take care of me. Has anybody ever held that feeling that they just were not taking care of themselves? They were the last one on the list. And I got really sick, and I spent 11 days in the hospital and 3 months out of work. And as I climbed back out, I realized a couple of things. Number one, you don't die wishing you'd spent more time at work. And that if I didn't start taking care of myself, I wasn't going to be around much longer. So at the time I was in my 40s, I'm now 73, and my life is going really well, and I feel like I really have my health under control. There's always room for improvement, and I'm working on that every day, but I'm happy where I am, and I'm expecting to live another 20, maybe 30 years, which is great because I have a wonderful husband, and I'm happy to be able to spend that much more time with him. We live in a confusing world. We want to be healthy, but we're given misinformation all the time. We're told, companies tell us to drink sodas and eat candy, have a Snickers, drink some Red Bull. Bet you can't eat just one. The companies have spent billions of dollars on their research to figure out what it takes for you to become addicted to their food. It's a combination of sugar and salt and fat and artificial this and that, which are not good for our bodies, and they don't really care about that. All they care about is how much money they're going to make because you are going to think that this is what you want to put in your body. They actually corrode our taste buds so that when we start trying to eat healthy food, our taste buds say, ooh, I don't want that. I'd much rather have another piece of cake. So, we are in a bind. We're in a bind, we get a lot of misinformation. Where do we go from here? Well, let's take a lesson from our cars. What do we do with our cars? We put the right gas into them. We change the oil. We rotate the tires. We get tune-ups. Would anybody here ever go on out and buy a Slurpee and pour it into your gas tank? I don't think so, because the car wouldn't go much farther then. What we do with our bodies, though, we don't even know how to go about making healthy choices, in many cases, healthy choices for our bodies. So what's the difference between taking care of your car and taking care of your body? Does anybody have an answer? Okay, so the answer...
We take more better care of the car than
we do. We definitely take better care of our car than we do of our bodies. And the other part of the answer is, when our car dies, we can get another car. But we only have one body. So what are we going to do with that body? Are we going to take care of it, or are we not going to take care of it? 90% of the illnesses in this country are caused by the food we eat and the lifestyle we live. 90%. And if you look at other countries, you will see that they have a very different ways that people die. Everybody dies. We're all going to die. My son had a fellow working with him, 46 years old. Danny had decided he was going to take care of his health, pretty soon. Isn't that where we all are? Pretty soon we're going to do something. So Danny's plan was that when he came back from his trip up to New York City to go visit his 18-year-old son, that he would start losing weight, putting more nutrition into his body. But Danny had a heart attack on his trip, and he died. One of the things that I'm really proud about is over the years, as I have become more and more aware of nutrition, I have taught my kids and my grandkids about nutrition as well. I just came back from the graduation of my oldest grandson, who just graduated from college. And he is every day doing incredible things, calls me up, Grandma Carolyn, what do I do now? How do I cook the sweet potato? And it's really fun to have a relationship, even though he lives in a different state. My son, one of my sons, his cholesterol had been out of control. He's 47, and there's a ratio of good to bad cholesterol, one that we don't usually think about, but the ratio is supposed to be 5 or under, and his ratio was 13. And when I found out about that, I thought, oh my, I could lose my son before I die. And that's a scary thought. After a year of doing some healthy products, you'll hear over the time about some products from Purium. There are lots of different ways of making changes. These are a really easy, effective way of doing it. After a year of using these products, he took his ratio from a 13 to a 4. My granddaughter wasn't growing. She was at the bottom of the height chart. And she had not grown for 2 years, and the doctor said if she doesn't start doing something different, she's going to be 4'10" as an adult. You know what that means? It means you buy all your clothes in the children's department. Not much fun when you'd like to be a grown-up lady who's the president of her own company or something like that, and you're in polka dots and ruffles. She also changed her nutrition, and in the next 3 years, she grew 3 inches, 3 inches, and then 5 inches. So she's 11 inches taller right now. She's never going to be the Statue of Liberty, but she is going to be able to get into the adult section in the clothing. So that's a good start. My father, when he was 85, he was diagnosed with Alzheimer's. Now, Alzheimer's is interesting. In this country, if you're 85 years old, you have a 50% chance of having Alzheimer's. 50%. If you're 85 in Europe, you've got a 20% chance. And if you're 85 in India, you have a 0 chance. Now, maybe some of the people in India don't get observed, so maybe it's not 0, maybe it's 2, maybe it's 3, but we're not talking 50%. And why is this? It's got to be about the way we take care of our food and the things that our regulations allow to be put into our food. There are a lot of artificial colors and artificial flavors that get put into food in the United States that do not make it into Canada, do not make it into Europe's food, and then we don't always make all of our own food either. Every day you make 10 billion cells. Your body makes 10 billion cells. And those cells are made with whatever you eat that day. So if on a certain day you have 2 donuts and 3 Diet Cokes, that's the building blocks for the cells you're going to make that day. Your intestinal cells are totally changed every 5 days. Your stomach cells are totally changed every 30 days. Your red blood cells are totally changed every 120 days. So you could change your nutrition totally today, and in 120 days you would have replicated a much healthier body. And if you don't change it, then every day that you make these inefficient cells, because you can't very well make a good cell out of donuts and diet soda. We know that. All of those inefficient cells then build, and what happens is diabetes or cancer or arthritis or dementia. And we say, oh, where did this come from? This doesn't make any sense. I've been good. I've done everything I should have, and it just happened to me. But these things don't just happen. So what does it mean if you start taking care of your body? It means you don't die at age 46. It means you don't have to get your foot amputated. It means you can keep all your fingers. You can find food that tastes good and nourishes your body. I mean, I think there's a big feeling that people think, well, if I'm going to have to eat healthy, it means that I might as well just go out in my yard and eat my grass. But I think Reverend Faye will attest to the fact that I brought a healthy stew and salad at the last event, and people loved it, ate it all up. There was nothing left. It means you wake up in the morning full of energy, so you can play with your kids or your grandkids or your puppy or whatever it is. One of the things that excites me is seeing little kids who are understanding about nutrition. I mean, my grandkids have started their nutrition path, some of them from conception, and some of them from 8 or 10 years old, at the point that they understand what it means to put good, healthy food in their body. So every single day, as they're replicating their cells are replicating with more power. And that's really what we want for ourselves. So let's talk about diabetes. Diabetes is a really manageable disease, but so many people suffer from it or die from it. It's the leading cause of blindness. Diabetes is the leading cause of amputations, and it's the second leading cause of impotence. 20 years ago, they did a study at UCLA, and it's called the 5-4-3-2-1 study, for reasons that you'll find in a minute. 80 people started. The study only took 21 days, and before the end of 21 days, half of the people had dropped out. And when you hear what they had to do, it doesn't sound that hard to me, so I don't even understand. But these people I guess they were missing their Ho-Hos and their Pepsis. So in 21 days, these people were each day to eat 5 slow-burning carbs, 4 dark green leafy vegetables, 3 healthy proteins, 2 dark red fruits, and 1 hour of exercise a day. And at the end of those 21 days, the whole 40 that finished it, every one of them had lost their diabetes symptoms. 21 days. What a huge impact. And isn't it interesting that even for 21 days, 50% of the people gave up before the end? I'm always looking for pure, nutritious products. That's one of the things that I like to help people with. I like to help them with simple answers. So for the last 5 years, I've been working with a company called Purium, and I love Purium products. I've been through the manufacturing facility. I know the quality. I know the amount of care they put into everything. They check everything to be sure chemically that it's exactly what they think it is. So there's a lot of work that goes into giving us the purest, cleanest products available. And when they heard about the 5-4-3-2-1 study, what they did is they created a package of foods that would allow you to have that mix of foods. So they actually have a program that you can take where you buy 10 days worth of product, and in those 10 days, it's amazing what a transformation there is in people's bodies. Or if you want to go for longer, There's a 40-day program. It's amazing how many people in just those 10 days get their sugars under control. It's absolutely exciting to see all the different things. I knew a woman who was addicted to sleeping pills, and in 10 days she was no longer addicted to sleeping pills. And people who have had no energy. I even know a couple who did this for, year and a half. I mean, we're talking about a lifestyle. You don't do the whole heavy-duty program the whole time, but I put some of these products into my body every day. This couple put some into their body every day. They had tried for 8 years to have a baby, and with no luck at all, they now have 2 healthy babies. It's amazing what happens to our bodies when we make the choice to treat our bodies as well as we treat our cars. The Purium has over 70 products. So there's weight loss, energy, stamina, sleep, athletes, kids, anxiety, focus and concentration. What I really want you to take away is that you get to decide if you want to live to 60 or you want to live to 90. You get to decide if you want to do it by dancing every day or sitting in a wheelchair. And these are questions that we really need to confront. I'm not trying to be doom and gloom, but the time is now to decide to take care of your health and to make some choices. And I hope that you decide that you'd like to work with a health coach who can help you to make the best choices and with some really great products.